Hello, my name is Trevor Smithson. This summer, I was one of the rural scholars living in Southwest Oklahoma, and I was doing research on rural healthcare and perspectives in telemedicine. My research teams, Dr. Mark Woodring, Dr. Brian Whitaker, Laura Brooks, and then myself. And so let's get into it. In the overview, like I said, I was in Harmon and Tillman counties, living in Tipton, conducting research in both counties, though, primarily Hollis for Harmon County and Tillman County, Granfield, Frederick, and Tipton. And the main goal really was just to find new ways to make healthcare more accessible and affordable for rural communities, building on the research that had been done last summer as well. And then from that, determine the viability of telemedicine-based solutions in rural areas. Just see what people's perspectives are on telemedicine. Are they open to it? Do they like it? Are they even able to access it based on where they live? And then afterwards, to share the data with a wide variety of interested audiences. So we went into this knowing that we wanted to collect data and then just share it with people who could use it to continue to try to find solutions to bridge the gap that rural America and rural Oklahoma specifically are facing in regards to healthcare. So my methods, I completed semi-structured interviews with 11 local individuals in both counties. And these ranged anywhere from businessmen, firefighters, extension agents, healthcare professionals as well, nurses, nurse practitioners, just to see what their thoughts were on their access to healthcare, what they saw the limits were for other people in the community, and then if they had any telemedicine experiences, especially during the COVID pandemic. I also utilized a survey to collect qualitative data from residents of both counties, and this was done both online and in paper, which gave us some really unique results that I will highlight in a minute. The online surveys, I marketed them through Facebook as well as word of mouth. But on Facebook, I was able to target for individuals 18 and older, whose location at the time they were on the app was either in Harmon or Tillman County. And then I showed bias in that as well for individuals more likely to click a link. And so Facebook targeted individuals who, based on their metrics, were more likely to click a link on an advertisement. Brief overview, I ended up getting 206 survey responses. We were really excited about that number, as well as the split of 52% online and 48% paper. Kind of gave us a good perspective from both ends of the spectrum. And then these two pictures on the right are examples of the ads that went out on Facebook. The one on the left was done later, and the one on the far right was the first one we put out. Really good success with those, was able to track them over the periods that we had them out. The first one was a 10-day advertisement, and the second one was a 7-day. A few questions that we asked on that survey. We did a 1 to 5 Likert scale and then some yes, no, and maybe questions as well. Something like, I believe telemedicine offers the same quality of attention and care as in-person visits. I always followed the CDC recommended COVID guidelines. That question particularly was very interesting to see, especially because we expected people completing the survey online as opposed to in person to maybe be a little bit more concerned. And we actually saw statistically significant difference the other way. And on most any questions in regards to social distancing, telemedicine, or just general COVID precautions, the online survey respondents actually were less likely to be in favor of those or follow them compared to those paper copies. A few other questions. I felt my healthcare needs were met during my telemedicine experience. And then, are you comfortable with a telemedicine visit when it relates to your healthcare? We also asked that question about their spouse, significant other, and their children if they had any. So overall, our findings, still digging through the data to some degree, but it's a great way to save time. Telemedicine for sure is, but it's not a replacement. And a lot of the individuals living in these counties can kind of see that it is useful in certain scenarios, and they like it, especially when they can't get off work or don't have the time to travel, but it's not a replacement. A lot of them still like having that person-to-person interaction and that one-on-one visit that a typical doctor's visit provides. And so going into the future, that relationship is still important to a lot of citizens. And I think they want to keep that if at all possible. And this especially holds true for online respondents, like I said earlier. From this, and because of the statistically different data that we have found, or statistically significant data, we're actually going to do some more analysis on the paper and online survey responses and where they're the same and where they're different, and looking to get some published research on the difference in those methods. So we're really excited about that. And overall, we just want to share this data with anyone who needs it. And these would be places like the Telehealth Alliance of Oklahoma, OSU Center for Rural Health, OSU Department of Agriculture Economics, Oklahoma Office of Rural Health, and the Oklahoma Department of Health, just to name a few. Like I said, we want to use this to help continue to take strides in rural healthcare and help those people who maybe don't have the best access to continue to find new ways to get them access, not only so it's easy for them to get the care, but so that they're actually able to utilize it and take better care of themselves. Lastly, I'd just like to thank a few people, my research team, Dr. Woodring, Dr. Whitaker, and Laura Brooks. Without them, definitely couldn't have done any of this. They helped me a lot, both in insight, guiding me, and helping me set everything up through SurveyMonkey and things like that. Along with that, Ginger Creech with the Shortgrass Clinic in Hollis, Oklahoma. Without her help, our paper surveys would not have been near as much as they were. She really helped me get those out and spread the word and have people fill them out for me. Aaron Henson with Tillman County Extension helped network me, especially in Tillman County, set up some interviews for me early on to help me get my foot in the door in the community. Craig and Carrie Ripley of Frederick, I actually knew them coming into this, and they invited me over at least once a week for a nice meal. And so it was like I was home the whole summer. And their hospitality was tremendous, and I'm very thankful for it. And lastly, the participants in my research, both those who did my surveys and who took time out of their day to sit down and interview with me for about 45 minutes. I really appreciated their ability to sit down and help me try to figure some more things out. So thank you.